Welcome to the Rim Break Rodeo. We hope this video helps.
You begin by confirming identity and setting boundaries. This builds trust and ensures safety. Once done, ensure privacy and discuss confidentiality. Make sure the patient knows limits. Start with a broad, open question, then narrow. This captures chief complaint and context. Ask timing, severity, and any associated symptoms to orient the encounter. Explain why each question matters. It highlights red flags and guides exam urgency. You should document exact quotes for chief complaint and timestamp entries immediately. You now explore the problem in detail using OPCUS to capture onset and pattern. That reveals mechanisms. Then review past medical and surgical history, medications, and allergies because these affect diagnosis and treatment choices. Include social factors, work, living, substances, since they change risks and adherence. Next, elicit family history and targeted review of systems to catch related conditions. Make sure to reconcile meds with lists or bottles. This prevents harmful interactions and informs immediate management decisions. You finish by summarizing the key points aloud, asking the patient to confirm or correct. This reduces errors. Once done, explain the proposed plan, investigations, treatments, referrals, and expected timeline, and obtain consent for any procedures. Document the plan, safety net advice, and follow-up instructions with times and contacts. If details remain unclear, contact family, previous providers, or review records. This troubleshooting step prevents misdiagnoses and ensures continuity of care.
Thanks for watching. Consider subscribing if we helped you.